Hi, I'm Dr. Baird, optometrist and owner of Baird Optical. Thank you for tuning in today for our first episode of a series of informative lectures on ocular health, anatomy, physiology to help our patients and you understand more about your own eyes so you can take charge of your ocular health. Today, the first series, or the first episode, we're just going to focus on basic anatomy so that when we're talking about different structures in the eye, you can kind of relate and understand what we're talking about. I have a little eye diagram that we're going to use to kind of go over different structures and parts, and I'll try to relate them with things you may have heard of, but obviously we'll get more in depth later on. This diagram obviously shows a lot more than what you typically see when you look at someone's eyes. Typically we're just viewing the front portion, maybe the white part, the clear dome of the front, and the color part of the eye. To start out, the clear dome in the front is your cornea. The cornea is obviously a protective mechanism from anything going in, but it also needs to be clear to let light in so that we can see. Right on the outside of that cornea where it meets the white part is the sclera, and where they meet is the limbus. Now the white part, the sclera, is a protective portion, kind of gives the eye its shape and structure and also protects it as well. Over top of that sclera is a clear mucous membrane connective tissue layer called the conjunctiva. You may have heard of conjunctivitis, which is inflammation of that tissue, better known as pink eye. Now as I spin the diagram around a little bit, you'll see lots of red muscles that extend back from the eye. Each eye has 6 muscles that kind of coordinate the movements with both eyes together and turning the eye in different directions. There's 4 that go straight back, the recti muscles, and 2 oblique ones that kind of turn it at angles. At the top, you'll see a little globular structure here called the lacrimal gland. That's the main gland that produces tears for your eyes to help lubricate and keep your vision clear. As I kind of remove that, I can open up the eye a little bit more now. And obviously on the inside of the eye, we can see the first structure is the color part of the eye, your iris. That iris is a muscle. It can kind of change the shape and size of the black hole in the middle called your pupil. The pupil is really just a hole to the inside of the eye, so when light passes through your cornea, the next thing it passes through is the pupil and goes into the eye so that we can see. If I gently remove this, the red part, which is directly underneath the sclera, the white part, is the choroid layer. That choroid layer is basically a network of veins and arteries, vasculature, that help nourish the tissue there and take the old blood away. I'm going to remove the iris so I can open up the eye. So right behind the iris, the first thing light's going to pass through is your lens. The lens is also where cataracts will eventually form in people's eyes just from normal aging changes. And through that lens, then it goes through a gel-like substance called your vitreous. The vitreous is kind of like a cushioning agent or protective agent in the back. It should be pretty clear, but eventually we can get floaters and things like that, proteins and pigments floating around in there that we'll sometimes see. As it passes through the vitreous, it eventually hits the lining of the back of the eye, which is your retina. The retina is kind of like that camera film inside your eye. It helps take the light energy that we're looking at, convert it into a chemical energy, which then passes back to your brain through your optic nerve. The optic nerve is one of your 12 cranial nerves connecting your eye to your brain. That also is the start of the visual pathway. The visual pathway not only goes from taking the message from your retina back your optic nerve, but then it also has to travel all the way back to the back of your brain and your occipital lobe where your vision is processed. And that in a nutshell is how we see. And also in a nutshell, that is the ocular anatomy we'll be going over today. In future lectures, if you be so kind to continue watching, we'll go over different structures more in depth and their relationship to different ocular diseases and problems that you'll hopefully not have to deal with later in life, but possibly hear of and may have to deal with. Thank you for watching today. I appreciate your time, and in the future, we'll see you again. Thanks.